Hello, my name's Heather Knox and I'm the Chief Executive here in NHS Lanarkshire. I want to talk to you a bit today about some of the key priorities we're facing as we move forward following our recovery from COVID-19. As we move forward, we are looking at redesigning the way that we manage urgent care across NHS Lanarkshire and indeed across NHS Scotland, and there'll be more detail on that to follow, but that'll be done very much in partnership with our GP colleagues and NHS 24 and of course our acute colleagues within A&E. Secondly, we are, as you know, facing a bit of a backlog around our scheduled care, and we're working closely with our clinical colleagues to go through every single patient and check that we've got them in absolute priority order, and most urgent patients will obviously be seen first. The third priority I wanted to talk to you about today is our public health service. Our public health service here in Lanarkshire have been absolutely fantastic right from the beginning of COVID-19. They mobilised earlier than anybody else because if you remember back, they were doing the contact tracing right back in January, February time of this year. They have then had a key role obviously in the mobilisation and our resilience planning. So they've taken all of that forward with the goal command structures and the IMTs every day for COVID, and they're now carrying on playing that key role around the IMTs as our schools go back and the contact tracing role just becomes ever more pressing really for us. I'm pleased to say today that I've agreed some further resource for our public health colleagues. We're waiting to confirm some allocations of funding from Scottish Government, but I think it's the right thing to do in advance of these sums coming through to give them that extra support and help that they need at this time. Secondly, this week we were really pleased to welcome Jeane Freeman and Jason Leitch to Hairmyres Hospital. That was a very good visit. We went into A&E, we also visited Ward 10 and our ICU, and that gave Jeane and Jason an opportunity to say thank you firsthand to our members of staff who have supported us during COVID and worked to look after all the patients. And that was a really nice visit. So thank you to Jason and Jeane, but also to all the staff that took part in that visit and took time out of their busy schedules to talk to them. Finally, before I finish, I just want to ask if you could all take the time to complete the pulse survey. I know I mentioned it last week. I've done it today and it took me about 10 minutes. So if you can, it will help us to look at the best ways that we can support you going forward to look after your well-being. I'm going to finish by just saying, as I do every week, thank you to all of you for everything you do every day for all of our patients. Thank you.